You,
Hi
Dr.
everyone.
Dr. Hani sir and all those participants in this session. Good morning, good afternoon, and good evening. Welcome to the 1392nd day of continuous and uninterrupted Zoom session of IFPH. Let's start today's program with a silent prayer for a minute. Thank you. Today, our guest is Dr. Shalini BHMS. He's a promising, young, talented person. We all know that. She presented a couple of presentations on the IFPH platform. She's graduate from the Government Homeopathy Medical College, Bangalore, 2009. Certificate course in Children Health, CGH. Then certificate course in Gynecology and Obstetrics, CGO. Certificate course in Skin and Venereal Diseases, SDD from BIMD, Pune, Maharashtra. Then physician, duty doctor, Nisarga Clinic, Bangalore, Karnataka. The topic is hypertension and homeopathic management. On behalf of IFPH, and welcome Dr. Shalini, you can have the platform for the next 45 minutes. It's all to you. Okay.
So thanks so much. Hi everyone. I'll be discussing about the hypertension and its treatment. I'll just share the slides. Okay. So as we all know that hypertension in our day-to-day practice, so we'll see at least in one day, at least 5 cases of hypertension cases. So today I'm speaking about the importance of hypertension. What is hypertension? What are the types? What are the causes? And what are the complications? And how we can prevent it? And homeopathic management I'll be dealing with today. First of all, hypertension, it is the persistent increase of blood pressure. All know that our heart, it has many arteries and veins. So the blood pressure will be circulating in the whole body. So the pressure of the blood on the walls of the arteries is called the like the pressure of blood on the arteries, on the walls of the arteries, that is called the blood pressure. When this blood pressure increases, it is called hypertension, and when the blood pressure decreases, it is called hypotension. So high blood pressure is one of the major important factors which plays an important role in the development of various metabolic, cardiovascular, renal disease, among others. So we all know that in any case, first the physician will check the blood pressure only. So blood pressure is very important, not only in the functioning of the heart, it also regulates the CNS system, renal system, metabolism, digestion, overall the health of the body. Heart is monitored. Blood pressure is monitored or checked by the instrument sphygmomanometer. As we all know, it consists of a mercury reading, and a handcuff will be there and a bulb will be there. So the physician or the nurse, while checking the blood pressure, they will put the handcuff on the left hand, and the mercury is raised in the sphygmomanometer machine, and through auscultation, the stethoscope is kept on the cubital fossa of the arm, and then the systolic pressure and the diastolic pressure is okay. As we all know that the normal reading of the blood pressure, normal reading is 120/80 mmHg. Okay, when the above number 120 is called systolic blood pressure, and the below 80 is called diastolic pressure. So if it is more than 130, 140, the reading, then the person has essential hypertension. Next, I'll speak about. So pressure is more than 100. It is normal, 90 is normal. When the diastolic pressure is more than 100, then the patient is suffering from hypertension. So the blood pressure is the force of blood on the artery wall. You can see in the image, in the picture. Okay. So when the person has hypertension, when his BP is raised, or when his blood pressure is raised, what are the signs and symptoms when a physician sees, or what he feels is, the first is the headache. He'll be having headache, and there will be a blurred vision. Then there will be a chest pain. Then he'll be having shortness of breath. Then nausea and vomiting will be there. Then he will start nose bleeding. Then he will have the symptom of dizziness, that is vertigo. Then the patient will have flushed face, and there will be extreme fatigue. Fatigue will be there, and he'll be having the mental symptom of confusion, and there will be blood spots in eyes, and there will be irregular heartbeat. Hypertension is a very important and dangerous dangerous part of life, because when the blood pressure raises to 180, 190, then the patient may have sudden cardiac arrest, heart attack. Then suddenly he will go to unconsciousness, and when he's admitted into ICU, and he may go to a very critical phase of his life. So daily monitoring or regular monitoring of blood pressure is very important by any individual. So these are the signs and symptoms of hypertension. Okay. Now we'll see the types of hypertension. There are few examples of various types of hypertension. The first one is essential or primary hypertension. When the patient has a blood pressure of 140/90, then he has the essential or primary hypertension. Secondary hypertension means the patient is suffering in the range between of 140 to 160. 140, 160/80/90. That is secondary hypertension. Then there is malignant hypertension. Then there is isolated systolic hypertension. The another part is resistant hypertension. Then refractory hypertension. Then there will be postpartum hypertension. Means after the delivery also there may be postmortem hypertension for some phase, for some period. Then there is gestational hypertension, that is pre-eclampsia hypertension. Then there is white coat hypertension, and there is masked hypertension. And another part is labile hypertension. Then there will be nocturnal hypertension, and there is another part is permissive hypertension, and asthma hypertension, and carcino hypertension. So in any diseases or any thing, blood pressure is monitored by the physician. So along with asthma, he may be having hypertension also. In any cancerous patient also, hypertension will be there. So these are the types of hypertension. So regularly in our clinical practice, we see the primary hypertension, that is the essential hypertension. So in this case, there will be no identifiable cause. It is common in adults, and in some adolescent also it is seen. Risk factors is the patient when he is in obesity. 75% of the population, when the people are obese, when they are overweight, hypertension will be there in them. So hereditary causes is also, we can see, diet and stress also. The another very important types of hypertension is the secondary hypertension, occurs due to some underlying disease. When there will be some underlying disease, along with the hypertension will be there. It is common in infants and younger children. Causes varies with age. So these are important. Other types of hypertension is also very important, but this essential hypertension, primary hypertension, and secondary hypertension is very important. the types of hypertension. This is the chart where we can see the readings of the blood pressure. In the first column, the range in mmHg, second is clinical term, and the third is stage. So when the person has 120/80 mmHg, it is normal blood pressure. It is the ideal normal blood pressure. When the blood pressure ranges between 120/80 to 129/80, that is 130/80, then that is elevated blood pressure or the pre-hypertensive. Then the condition is pre-hypertension. And when the blood pressure ranges between 130/80 to 139/89, then that is called stage 1 hypertension. That is high blood pressure when the reading is between 140/90. And when the reading is between 140/90 to 180/120, then that is called stage 2 hypertension. That is high blood pressure. Then the patient is in very critical stage. And when the blood pressure is above 120/120, there is hypertensive crisis. That is very high blood pressure. Then the patient has to be shifted to ICU and the further treatment goes on. So this is the blood pressure chart. So now we'll see what are the causes of hypertension. The causes may be genetics, family history, genetic predisposition, and age related also the cause will be there. And the major cause nowadays is the obesity. And when the person is having poor diet, or when there is lack of exercises and poor lifestyle, like for example sleeping in the morning time and when he's wake up in the night time, and there is no regular exercise or physical activity, sedentary lifestyle, this may also cause hypertension. And smoking, alcoholism also play a very important role in the cause of hypertension. Excessive alcohol and not doing properly or regularly physical activity or regular exercises also causes hypertension. Now we'll see the complications of hypertension. When the patient unknowingly, like he'll be having the symptoms like vomiting or dizziness, headache will be there, but he's careless about himself and he doesn't go to physician or any doctor. And it is like a silent killer that BP will be raised in him, asymptomatic or some symptomatic. But if he has, I have seen in my clinical practice only one patient. He's not obese, but he has hypertension, and he's not like he's not going to doctor, or regularly he's not going for any regular checkup. So suddenly his BP is raised to 170, 180, and occasionally he was having vomiting and blurred vision, headache, and he was taking the gastric tablets, but the underlying cause is hypertension. And suddenly one day he had a very severe vomiting and unconscious stage, and when he was taken to a doctor, and when his ECG was taken, then he was having BP of 170, 180. Then and later on the treatment was given after that. Hypertension is like a silent. So regularly monitoring of BP is very important. There are many digital BP apparatus available in the online shops. Regularly check. Hope is also important. They can buy speak home, and we have to give awareness to the patient. Like they can do online this digital BP apparatus, and regularly if they check in the home, and if they see any raise the blood pressure, then they go to a physician or doctor. So the complications of hypertension is vision loss will be there. There will be sudden loss of vision, brain stroke, then there will be heart attack, and blood vessel damage will be there, and there will be sudden kidney failure will be there, and bone loss will be there. So these are complications of hypertension. What are the risk factors of hypertension? The various modifiable risk factors for hypertension include high sodium intake, taking, and low potassium intake, alcohol consumption, obesity, and lack of physical activity and unhealthy diet. So, those are the risk factors of hypertension. So, to any patient who comes to us, we need to awareness about the hypertension to go on a regular checkup, and any symptom they should not neglect. So how can prevent this hypertension? The thing is, even minor changes in a person can be beneficial.
Unfortunately, maybe due to some technical problems, the connection lost. Dr. Shalini, she was presenting very nicely regarding hypertension and its various aspects. Different types of hypertension, mentioned about 15 types of hypertension. Most interesting and important one, I think. The malignant hypertension, isolated systolic hypertension, the persistent hypertension, refractory hypertension, so many varieties are there. Maybe the more modern terminologies are there. Then regarding the blood pressure chart is also very interesting, and must remember about the stage 1, stage 2 hypertension, the hypertension crisis. It is above 180, 120, it is called hypertension crisis. This is again weight joining, yes.
This is a network issue.
Yes, quite natural. Don't worry. Disposition.
Yeah.
Should not make some sort of hypertension in you. Don't worry.
Yeah. Thank you. Okay. Okay. Like I was speaking about the prevention of hypertension, even minor changes in a person's lifestyle can be beneficial. Hypertension prevention can be done through the incorporation of various lifestyle changes such as weight loss, reduced sodium intake, increased potassium intake, increased physical activity, and reduced alcohol consumption, incorporation of DASH diet. So any patient who comes to us, we need to give the awareness about hypertension, like what is the importance and what are the complications of it. So daily exercising like cycling, jogging, swimming or walking, and reduced sodium intake, and physical activities should be increased. And if the patient is alcoholic, cigarette or any drug addiction, that has to be stopped. And proper homemade food has to be taken, and diet like green leafy vegetables, fruits has to be taken, and not to take like fried items, and western lifestyle of food has to be stopped. So these kind of awareness if we give, then it's very good, like we can prevent the hypertensive cases. Okay. Now I'll be speaking about a homeopathic case which came to me. Okay. The first presenting complaints or the preliminary data is that the patient aged 34 years, male, he's a farmer, marital status is married, and he had one son, 4-year-old. The chief complaints is that accelerated asymptomatic hypertension diagnosed during a regular checkup camp 2 months prior to our visit. The blood pressure BP range was between 181 to 160, 160 to 180, 110 to 120. He was resistant to starting hypertensive treatment as he believed that he would need to take the antihypertensive medicine for the rest of his life. So he was very reluctant. When we spoke to him, like your BP is this much and you need to take the medicine, as in allopathic treatment of line of treatment, the tablet has to be taken for lifetime. So he was saying that he was resistant, like the treatment has to be taken for lifetime. So I will not take the medicine. So this was the chief complaints of him. The patient as a person, his appearance was like he was having broad face with flabby hanging cheeks that was prominent. We can see the flabby hanging cheeks, and there was prominent acne scars on the face, and there was generalized obesity with the laxity of the abdomen. He looked older than his age. This was the prominent symptom appearance. He was craving for eggs, fish, sweets, and the thermals was chilly, and he had dreams. He was very angry was there. Large horned bull is running to hit someone. The dreams of large horned bull is running to hit someone. That is the dream, that peculiar dream he used to get often. And sometimes few angry bulls chasing to him also. He had dream of large horned bull is running to hit someone, and that bull is it is chasing him to hit. So this was the dream he used to get often. These dreams are since childhood. His sleep was disturbed due to dreams since childhood out of fright. So this was the dream, the peculiar symptom. And when his physical examination was done, his BP was 180/120, weight was 75 kg, and there was no fetal edema, or the pedal edema was not there. Respiratory system serious per abdomen NAD, no abnormal detected. Family medical history, nothing NAD nil. On investigation, lipid profile was normal, urine routine was normal, serum creatinine also. Diagnosis was essential hypertension stage 3. When his life space this was very important, the case part, life space investigation. The patient was serious and non-expressive during the interview when we were taking the case. He was born and brought up in an extremely underprivileged family and faced numerous adversities in his life. When asked about his childhood, he said that he never had a good childhood and had been similarly pursued by others. His family comprised an elder brother and mother. His father died when he was 1 year old, so his brother started earning. But even that was insufficient, hence, the patient started working at the age of 10 years. He would work after school. He was an average student, so he studied only till the 12th standard. Since childhood, no one had taken care of him. He said he was not blessed with a good childhood one could be nostalgic about. He said he did not bother to think about it. He also said he was unable to recollect his childhood memories due to the family's miserable condition. Their financial condition was so poor that they could not afford even the necessities like food, clothes, and household things. But they never asked for help from others. They often had to sell their possessions to afford food, and most of the time, his family had faced starvation. At the age of 15 years, he started helping poor and needy people around him. He was unaware of why he helped them when he was deprived of the basics. As he helped solve people's problems, he became very popular in his village. In doing this, he developed the ability to deal with people and get work done. He accepted the position as he feels that since he experienced the pain and suffering of poverty, he can help people better. His relationship with his older brother was good. Later, the brother got married and decided to live separately. The patient accepted this turn of affairs without any emotional disturbances and hesitation. However, the patient received no help from the brother when he got married or when his wife was pregnant and had a medical emergency. His relationship with his wife was good. Patient managed by himself without any emotional outburst and a neutral attitude towards his brother and circumstances. He said he's calm and never became irritated or agitated. Selection and approach of the medicine. Structuralizing approach to the case depends upon its symptomatology and quality. In this case, evident unconscious reactions expressed through dreams and behavior revealed the problem genesis. This helped avoid the essential evolutionary totality. The genesis and essence of problem will not be understood or identified if any other traditional approaches are directly applied over a case without understanding the evolutionary totality. Due to a paucity of characteristic qualified expressions at the mind and body level, we had to follow the non-repertorial approach of structuralization. Concepts introduced by Sigmund Freud were used to understand the structure in terms of evolution, adaptation, and dreams. The case analysis. The patient was severely deprived in terms of basic physiological and psychological needs since childhood. So these are the points to be taken in the selection of the remedy. As he said, he was never had a good child, indicating deep bitterness, starvation at the level of the body and mind evoked a forsaken feeling in him. The repressed hostility caused by the emotional turmoil was expressed through disguised dreams, such as angry, large horned bull is running to hit someone, and bull are notorious for their unpredictable aggression. The presence of the bull Bulls are notorious for their unpredictable aggression. The presence of the bull in his dreams symbolically represented the fulfillment of the patient's repressed aggression. The subconscious impulse reached to consciousness during sleep and it disturbed his sleep. The patient's altruism, despite his own adversities, indicates a certain strength and a unique way of adapting to his stressors. Repression served a constructive purpose to him. Even after marriage, when his brother refused to help, he managed without any emotional turmoil. The expected emotional and behavioral reactions to the circumstances were absent. The same pattern of response is observed in all stages of life. The other important aspect of this individual was fixity. He had fixed ideas about anti-hypertensive medicine and he did not want to be deprived on medicine all his life. This led him to resist the physician's advice. And there was prematurely old appearance, acne scars, flabby hanging cheeks, generalized obesity with prominent abdomen and hypertension or the predominant psychotic expression at the physical and pathological levels. So these are the points which we need to take for the case analysis. very important points. In the totality of symptoms, there is forsaken, deprived of love and care, there is repressed hostility, toughness is there, independent, responsible, fixity is there, helpful is there, dreams angry, large horn bull is running for hitting someone, and there is premature old looking appearance, acne, scar marks. These are the totality of the symptoms. So the final impression is the magnesium card. The remedy should correspond with the portrait of illness in terms of the evolution of the person, quality and pattern of adaptation, and the response of life experiences along with the physical characteristics. Lycopodium appeared similar due to the responsibility, strength, and prematurely old features, but Lycopodium lacks the sensitivity to being forsaken, repression, and altruistic patterns of adaptation. And the another remedy is carcinosin was also closed due to its responsible, benevolent, and altruistic response, but it lacks the strength to deal with the hardships of life, and it does not show prematurely old features. From the above analysis and psychodynamic study, the magnesium group of remedies were the most similar. Although magnesium does not cover the specificity of dream in the repertory, but it covers the essence of dream. The another remedy, tarantula, cover the specific dreams, but do not correspond with the rest of the portrait and totality. The repressed emotions are not destroyed but go on seething inside, such as volcano, finding expression through various devious channels. The most striking channel is the dreams. The sleep is consequently disturbed with starts shrieking, talking, and weeping. Another peculiar feature of magnesium is their seemingly stress-resistant personality that gives the person strength of character and a human disposition. Due to the strength of character, magnesium converts the deep and negativity of the love experience into the positivity of giving love. He goes out of his way to help people. The other important disposition of magnesium carb is fixity. He has fixed ideas and resists change. Fixity of ideas, values, attitudes, and feelings make him immobile. Magnesium is a deep acting constitutional remedy of its expression in all four miasms. At the physical level, premature sensitivity is marked in magnesium due to affected elastic tissue, elasticity, lost skin hangs, acne scar marks, and offensive discharges that leave inedible stains or the peculiar features of magnesium. And the planning and programming of treatment. The first one is the susceptibility. Nature of disease, chronic, accidentally detected. And asymptomatic, BP ranges between 160 to 180, 110 to 120 with no signs of symptoms. No characteristics of the tissue level, pathological functional susceptibility on the lower side. Sensitivity, moderate to high, mind, dreams, sleep disturbed due to dreams, availability of unconscious reaction and its expression. Repression, emotional hostility, aggression, correspondence at constitutional medicine, mind, body. Vitality is good. Dominant miasm is psychotic. Considering the above parameters, magnesium carb 200 potency was selected. Discussion, I'll just tell in a very brief manner. This case was managed on an outpatient basis. The patient opted for homeopathic treatment to avoid antihypertensive medications. Through this case, we would explore the efficacy of the homeopathic medicine in essential hypertension. The problem definition was an indispensable aspect and strength of the case. Through this, the physician gained the confidence to formulate a therapeutic plan in terms of constitutional medicine, and involved clearing the prejudice about the use of hypertensive medicine. The patient was concerned regarding the consequences of untreated hypertension and certain limitations of homeopathy. Antihypertensive medication was put forth in an option of and got work successfully within a reasonable time frame. This was a limitation of the case. An essential aspect of the case was the psychodynamic dimension identified through the behavior and dreams. Freud started the dream should not be taken at face value. In this case, the essence of dream was more important when using the structuralization approach with the magnesium group of remedies. Has been researched, it remains poorly represented. Researched in the materia medica and repertory. Therefore, in this case, the traditional approach would have been helpful for this case. Processing the underlying depths of the patient, the portrait of magnesium establishes the ICR structure, and their unique analytical tools help the treating physician to analyze and evaluate the case and achieve the expected outcome. The conclusion is that the case report demonstrates the role of unconscious emotions in treating essential hypertension through psychodynamic study. It includes the identification of concealed repressed desire through the dreams, and in somatic effects, a repression was identified, and a core defense in this case, hostility of unconscious emotion born in the adversity, and it was represented symbolically. And the most suitable simillimum in terms of portrait of the disease and symptom similarity is the magnesium CAR. Administration of magnesium CAR generated an effective action result complex in stage 3 essential hypertension. Other homeopathic remedies for the high blood pressure is the foremost is the allium sativum for high blood pressure with high cholesterol. Allium sativa is a medicine for high blood pressure with high cholesterol levels. This medicine helps in reducing cholesterol levels as well as lowering the blood pressure. Other symptoms include a pain in the chest that prevents sleep and leads to palpitation. As we all in the case study, magnesium carb helped in that case. So these are the other remedies which help in hypertensive cases. And the second one is the amylinum nitrosum for high blood pressure with constricted sensation. Amylinum nitrosum is a medicine for high blood pressure when constricted sensation around the heart is the main symptom. Along with the constriction, aching in the heart is also present. A sensation of swelling in the chest, fluttering in the heart, and intensified beating of the heart or the other symptoms that indicate the need for this medicine. The another remedy very important is the Cretaceous oxyacantha to dissolve calcareous deposits. Cretaceous oxyacantha is a medicine used to help lower the blood pressure by dissolving the calcareous deposits in the arteries. Symptoms indicative of this medicine include pain in the region of the heart, oppression of chest, accelerated pulse and irregular pulse. Other symptoms include anxiety and cardiac dyspnea. Other remedies is the glonium for high blood pressure with headache. Glonium is a medicine for high blood pressure accompanied by headache. The headache feels intense and congestive throbbing and bursting in nature. Other symptoms include strong palpitation, dyspnea, and there is heat in the face and cardiac pains radiating to other parts, exertion leading to rush of blood in the heart, and fainting spells in another feature that indicates the need for this remedy. Glonium is also indicated for nephritis, kidney inflammation with high blood pressure. The another important remedy is Naxomica for high blood pressure in young people. Naxomica for high blood pressure is useful medicine for young people who adopt sedentary modern lifestyle habits. These lifestyle habits include smoking, alcohol consumption, sedentary routine, a lack of exercise, etc. These factors predispose a person towards blood pressure. Another important remedy is the Tabacum nicotinum for high blood pressure in tobacco users. Tobacco nicotina is a medicine for high blood pressure used in cases where the person has a habit of taking tobacco. Symptoms include palpitation, especially while lying on the left side. there is oppression in the chest and a rapid pulse. Other symptoms include pain between shoulders, inability to take a deep breath, and twisting sensation around the heart. Another remedy is the Stephanthus high blood pressure due to arteriosclerosis. Stephanthus is a medicine for high blood pressure in elderly persons due to arteriosclerosis, hardening, thickening, and loss of elasticity of the arterial walls. Strong palpitation that get worse upon emotional release and exercise are noted. The symptoms include constricting behind the breastbone, difficult breathing, alternating rapid and slow pulse. Lachesis, another remedy is lachesis for high blood pressure during menopause. Lachesis is perhaps one of the most leading homeopathic remedies in controlling high levels of blood pressure. Lachesis may be given when there is marked restlessness physically as well as mentally. Another striking feature for prescribing lachesis is that anything tight around the neck, like closed collars, neckties, or tight necklaces, are unbearable. Even tight clothes are unbearable. Feel better by loosening the belts or by wearing loose clothes. Lachesis may be given in high blood pressure in women who are in their menopausal age or post-menopause. Natramur for those with salty tooth. As we all know that natramur means the patient craves for salty things. Natramur is one of the most indicated remedies in cases of high blood pressure, which occur due to a prolonged intake of high levels of salty things. Due to this, there may be swelling of the feet in the morning. Natramur may be given in cases where there is unusual fatigue, especially in the mornings. Though there is restriction for excess salt intake, it is seen that there is an unusual craving for salty things like pickles, papads, etc. There may be a sense of tightness around the chest region and palpitation on slightest exertion. Natramur may be given. High blood pressure associated with hyperthyroidism and goiter. There is extreme sensitiveness to any other external stimuli like sound, smells, or lights. Natramur may also relieve headache due to high blood pressure. Like last week, there was a free health camp and awareness program regarding hypertension in a village in Dottanallur Halli. So the signs and symptoms, causes, complications, preventions of hypertension, types were explained to the people, and free health camp and awareness program was given in the last week. So this is about today's topic. Thank you so much.
Thank you, Dr. Shalini. As always, she is doing some wonderful work. This is also not an exception. Especially a lot of patients are suffering from this hypertension. Your approach is very good. Purely homeopathic one, understanding the homeopathic pathology. Time for discussion. Those who would like to participate, please raise your hand. You can ask some questions or you can make some suggestions or modifications. Around a dozen of medicines are described with their indications, not only some pros, but with indications. You mentioned about this Axomekia and Stephanthus only in the younger patients, the other one is old age patients. This is Axomekia in younger one, the Stephanthus in old patients, isn't it? Am I right?
Yes, sir.
Then what about the repetition of the medicine in such case, in this case, treated with magnesium carbonate?
Sir, the homeopathic remedy Baretta carb is also very important as it is a very constitutional remedy also, Baretta carb. The patient in the Baretta carb is very slow. Intellectual power is little slow. So when we take the case and based on the totality of symptoms, Baretta carb also works very good for the hypertension.
Okay. Then you mentioned about this diet, DASS diet. What is that?
So the diet, DSS means the diet of vegetarian like fruits, vegetables, and low salt intake, sodium intake, and high potassium intake.
Okay. Then mentioned about the bone density and hypertension. What is the relation between that?
Sir, in many elderly patients, when there is underlying disease along with hypertension like osteoporosis, arthritis, when there is calcium level in the bones are also decreased, along with that hypertension,
Is
this
there,
may
is there,
underlying disease also.
is there any direct relationship the pathophysiology or pathology? How it happens? You do know that.
Sir, rheumatic arthritis, osteoarthritis, um, the patient who is suffering with osteoarthritis or rheumatic arthritis, when their bone density is reduced or the calcium level in the bones are decreased, along with that, the patient is having hypertensive and diabetic also. So the complicated case. So we need to take the full case and we need to give importance to all these areas in selecting the remedy.
Okay. Then you mentioned the medicine of magnesium carb and beautifully differentiated with lycopodium, carcinosin, and tarantula. These are in fact really needed so that everybody can imitate it. Otherwise, by hearing some tips or clues, it will not improve homeopathy. That is the most important thing. Then you mentioned about couple of medicines, dozens of medicines are there. But I think one important aspect we must remember that even though all these so-called lifestyle is there, the patient is not at all affected with the miasms. Then definitely it will not affect him. That's the most important thing as mentioned by Hahnemann. It's not my opinion.
Yeah.
He himself quotes that I was free of Sora because of certain reasons. There was in the mentioned chronic diseases. Yes, even though he is used to smoke regularly, he was not affected with any such conditions. With constipation or some other problems, sleep problems, memory problems, nothing is there because he is not having Sora. So that's the most important thing. Dr. Ram Parvesh Shah, what is your opinion, sir? I think he was very contented with your presentation. Dr. Ram Parvesh Shah, yes, please. Unfortunately, your network is not in good touch for the last 2 days. What happened? We can't hear you. Sorry, we couldn't hear you. Not audible. What's the problem? If anybody there would like to participate, please raise your hand. That's an important aspect of this presentation because our participants for presenting, they are working hard to make some presentations. So a timely response from the honorable audience or participants is an important factor to make this program a great success. Sorry, Dr. Ram Pravesh, we cannot hear you. Some problems in your connection, unfortunately. Then you mentioned about dozens of types of hypertension. What is from where you got all these informations? It's quite interesting. 15 types of hypertension are there.
Yeah.
I think it is not at all mentioned in textbooks in our time. Maybe they are now. Am I right? Yes, please.
Sir, actually in textbook we get only essential hypertension and secondary hypertension.
Yes.
These other types of hypertension, I got it in the Google.
I think it is always better to not to depend Google for such presentations. There may be some fake or wrong informations, even though everybody is accepting that, but the credibility or the veracity of the problem may be in question. The presentation may be okay. Dr. Tanesh, the most experienced person and most important person from this IFPH platform. Dr. Tanesh, please.
Yes, definitely. What Dr. Manas told is absolutely right, because at times we may be mistaken due to some technical problem with these terminologies, as well as the point written in the Google. So you can always make sure that what are the things you get in the Google should be there in either any of the textbook. Otherwise, you can ask the question from where you get this thing into the Google itself, so that the Google will have to answer. That's a very important aspect as far as thinking. But practically speaking, hypertension itself is a condition where patients are threatened to be treated. That you need to take medication for even a simple hypertension. For example, I last some 3 weeks back, a boy was brought to the clinic, just 14 years of old, and he was under the treatment of a physician for after for this hypertension. So when he reached to the clinic, when I asked about some questions, at what time you wake up? Oh, doctor, I used to wake up by about 9 a.m. or nowadays. And when you go to sleep, oh, I go. He go to sleep by about 3 p.m. No, 3 a.m. in the morning. So that much of thing was happening during this vacation. He is about to reach, be promoted to the 9th standard, but in between, so much of time he was running. Then what are the things you are doing during the night and all the time? He told me that I am playing with this phone. So this is one of the things that we always sitting in the place and playing with phone. And no, then I asked him, why are you not playing with the in the ground? Oh no, doctor, and parents will not allow me to go out. So that is also a problem. So what I asked him that to ask them to do is that I just stop all this medication, and I shall give some medicine, and then we can do some exercise, and ask him to wake up by about 7 a.m. at least, since it is and sleep by about 10 p.m. And if he want to know anything with the phone, he can just use 1 hour for that. So, it was compromised, and within 2 weeks, within 1 week itself, the body he become normal. So this
It's
is
quite interesting. Dr. K.A.SHALINI is actually according to aphorism 4. It's a preserver of health. What are the things which drains health?
yes.
Then again, we know the diet and regimen, the importance of regimen. It's a very important thing as far as the treatment is concerned. Then again, the Dr. K.A.SHALINI mentions the general stimuli. What is needed for the patient? Because of the sleep pattern is very important. You know, the circadian rhythm. Recently, what happened is that everybody is addicted to this mobile phone. They're always keeping in touch with the mobile phone, not at all communicating with anybody. Lot of suppression is there, lot of eye strain is there. As a result, all these things happens. In that sense, we can say it's a lifestyle disease. Dr. K.A.SHALINI.
Yes, exactly. We as homeopaths had to look into all these aspects before giving any medication. And once we took the case in detail, definitely we will get the cause behind the illness, and we can go ahead before the plan. We can fix a plan of treatment. Whether the patient required medicine or not is not the question here. Of course, we as physician, we are consulting patients, and we need to give some medication for the satisfaction of the parents. As well, not only that, we can do is what are the things not to be done, what are the things to be done, and this is one of the these are the things that make you a total physician. Otherwise,
Yes, exactly.
you will be just like any other pharmacist or compounder.
Yes. Now
And that
there's a question in the chat box. Dr. Boric says lycopus, well, is it lowers the BP. What's your opinion, Dr. K.A.SHALINI?
Sir, lycopodium, yeah, lycopodium also is a very good remedy.
no, lycopus.
Lycopus, sir.
Yes.
Okay. Lycopus verdi. Okay. Yeah, Lycopus verdi is also a very good remedy, sir. So we need to take the proper case history, like life space investigation, like designs, aversions, thermals. Based on that, lycopus also works very good.
Yes, whenever you mention this thing, you must only use the word, it's a medicine, not a remedy. You must, there is a big difference between all these things. Homeopathy has got, it gives its own importance, all these terms to differentiate, how to discriminate is the most important thing as far as homeopathy is concerned. And you mentioned the pathology homeopathy, the individuality. You mentioned about the bulls are chasing him. That's an important, chasing others. It's an important thing, important dream. But that never become the total case. You have to mention or consider the other symptoms also. Thus, you reach the medicine MACAR, especially after the life space investigation. That's quite nice. Then what about the repetition in this case? Magnesium carb, how much you repeated?
So magnesium carb, the potency is 200 was given.
Repetition.
Sorry?
How much you repeated the medicine?
Repetition.
Yeah.
Repetition was done 1 month, 30 days apart.
Yes. 4 factors are there: the medicine, the repetition, the dose, and attenuation. All these things are important. When you select a medicine, especially after this kind of hard work, if you give medicine dissolved in water, that will often aggravate, especially when you're giving the remedy, not medicine. That's most important thing. Dr. Ram Parvesh, your net is okay? We hope so, pray so. You okay? No. Yes. We had to wait for the 5G to come in practice. Yes. This is the role of diet regimen. The communication with medicine to the body when it happens when there is some disturbance, as mentioned by our master in aphorism between 259 to 263. The sophist stones of a distant food that still in the midnight hours. That's a very interesting aphorism. You can all go through this aphorisms. Once again, read our homeopathic philosophies. Stick on the basics. Definitely you succeed. And I have a suggestion. Kindly concentrate a few types of cases. Then definitely we can improve it. Otherwise, if you treat all these cases, we cannot focus, we cannot concentrate because the world is now going through all specialties are there, specialization there. I think in the coming days, homeopathists must also follow that method. Otherwise, we can't advance because you mentioned a lot of new variety of cases and variety of presentations and classifications are there. So in order to cope with all these things, you must be more equipped. How it is possible? By not going through the conventional method, but we need some certain specializations and specialists as well as in courses. Otherwise, it's not possible to have such issues. So with that, a nice presentation, and as I mentioned, you have got a lot of talent, a lot of young persons are really participating and rocking this IFPH platform. Among them, on behalf of IFPH and expressing sincere thanks to Dr. Shalini. We hope we'll be back again tomorrow. Till then, goodbye. And so, Dr. K.A.SHALINI John, the former District Medical Officer, Department of Homeopathy, to follow the next session. Malayalam. Thank you.